Hello everyone, and welcome to abdominal and genitourinary injuries. So while this lecture is fairly short, there are some complex organs that can be injured in this type of injury pattern. So I want to make sure that everybody stays focused. We'll try to make things brief, but very concise and to the point. So by now in this part of the class, everybody should be aware that the abdomen houses several major organs, and there is two major muscle groups that are controlling the abdominal cavity, and that would be the diaphragm, basically separating the thoracic cavity from the abdominal cavity, the abdominis rectus. The muscles along the back are used primarily for a different reason, and then we have some small muscles in the pelvic floor. The abdominal cavity contains the liver, the stomach, the rest of the GI tract, the kidneys, and obviously the reproductive organs. So we're going to get into this. We need to remember that the anatomy and the function of the organs is very important, especially when you're trying to figure out like an injury pattern. And there's a very high incidence of morbidity and mortality with injuries to the abdominal region. Like we discussed previously, the abdomen is divided into 4 general quadrants. You may see other textbooks that divide it up into as many as 9. But for our general purposes, it's going to be right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. And when we say right and left, we're always referring to the patient's anatomy. It's not going to be what you see on your left, it's your patient's left or right. Now, why we can have some radiating pain and what we would call diffuse or not very pinpointed, the quadrant that's most affected is generally a good indicator of what organ system or what organ is actually the organ involved with the injury or has the inflammation. And so let's look at it from this perspective. If you have a right lower quadrant pain, that is normally something that's associated with, say, appendicitis. It would be one of the first things that you guys would probably draw to a conclusion, especially if it was a male. We generally know that if we're dealing with females, if we have right lower quadrant or left lower quadrant, we have more questions that we need to get involved with because there's significantly more parts internally on women than, say, men. So that can be a little bit confusing, but if you just know that little bit of anatomy to where the basic organs are sitting, you're more likely to be able to kind of rule in and rule out specific diagnoses. Just a reminder again that the abdomen contains solid and hollow organs. The peritoneal cavity is basically the abdominal cavity, and it contains many of these vital organs. The hollow organs are structures in which materials are going to pass. So if you're thinking about hollow organs, we're talking about the GI tract, the bladder, the uterus, the gallbladder. These are organs that are going to have some kind of matter passing through them, such as the chyme through the stomach into the small intestine, which then turns into feces in the large intestine, and then ultimately leaving the bladder having significant amounts of fluid leaving through it, through the urethra, and then obviously we have the uterus, which will have blood shedding every 28 to 30 days, but typically that's just a hollow organ because that's where we're allowing a fetus to grow. One of the bigger problems with hollow organs is that if it's ruptured or has some kind of trauma associated to it, it can spill its internal contents into the peritoneal cavity. And if you guys remember in the earlier lecture about abdominal injuries or abdominal issues, anything that goes into the peritoneal cavity that should not be there is typically going to bring in some kind of a bacteria or other things that we really don't want there. That's for the most part considered a sterile environment in the abdominal cavity, and if we get something like bile or some kind of feces or even just blood, we cause peritonitis, and then we can actually end up, if we have some kind of tear or rupture through the diaphragm, we can end up with a pneumoperitoneum where air starts to become trapped inside that abdominal cavity, causing some massive distension. Now, switching gears over to the solid organs. Solid organs perform chemical work in the body, and they are significantly vascular. If you damage one of these particular organs, there can be significant bleeding. I mean, we could just basically call that an uncontrollable hemorrhage, and it's a life-threatening emergency right now. The liver is extremely vascular because it's filtering blood. So any kind of penetration or rupture or laceration will cause a monumentous amount of bleeding, and the patients generally go into shock fairly quickly. If we start speaking about the spleen, the easy way to think about this is where we store red blood cells. And so two things will happen. The red blood cells are there basically for reserves, and typically those red blood cells are later in their lifespan. So the body will begin to reprocess those red blood cells or dump them back off into the body in the event of an emergency. So it's a little bit of a storage area and where we kind of recombine materials. The other function for the spleen obviously was to create some white blood cells. In the event of a traumatic injury and we rupture the spleen, there's typically a lot of bleeding in that injury pattern as well. And because the vasculature that's feeding the spleen, there can be even more bleeding. A common pain symptom for a spleen injury is referred left shoulder pain. In dealing with the pancreas, because of where the pancreas sits, which is a little bit more midline and it's fairly deep in the abdominal cavity, this is most often injured in a penetrating trauma. And if you guys remember, the pancreas is absolutely essential to glucose uptake because it's the creator of insulin. And so a well-functioning pancreas is essential to life. Okay, so now we're looking at a couple of different diagrams. And what you can see here is the peritoneum, and we have basically the peritoneal space. And what you're looking at here is that the liver and the stomach, the spleen, and the basically large sections of the colon are kind of sitting in that peritoneum. And then we have what's called the retroperitoneal space, and this is where organs kind of sit just outside of that visceral membrane, and they can pass back and forth. And if you're looking at the center diagram, you can kind of see the great vessels there as they descend down the thorax into the pelvis where they're going to branch out. The kidneys are going to sit outside of the peritoneum, and then as well as the uterus and the pancreas. Then when we're looking at the pelvic floor, you can see where things are kind of structured and situated as far as the sphygmoid colon, the bladder, the uterus, and other sex organs in males as well, with the spermatic cords descending through the pelvic floor into the scrotum. And then you can see the great vessels there are branching out into the femoral arteries and the femoral veins. While we're talking about that retroperitoneal space, the big thing to talk about is the kidneys. The kidneys are essential to life. If you guys remember those core organs with the kidneys, the liver, the brain, and the heart, as well as the lungs, obviously. The kidneys are essential to any kind of actual function in life because they are the primary filtration system of blood. And with any kind of kidney failure, we're actually really increasing the odds of death. And so if the kidneys are actually injured, one of the primary symptoms is going to be hematuria, which means blood in the urine. And if you're thinking about how you saw those great vessels, any kind of abdominal trauma that's significant, I mean, if we can get anywhere near towards the back because they're going to run along the anterior side of the spine, can cause or significantly worsen a AAA. And for the most part, a aortic aneurysm can happen just about anywhere, but there generally seems to be about two areas, and that's going to be right out of the aortic arch and then somewhere near where the branching or the bifurcation happens in the pelvis. And that's because as anything splits or bifurcates, we create a corner, which is a weak spot in the system. Obviously, just like chest injuries, abdominal injuries can be open or closed, and they can involve the hollow and or the solid organs. I mean, this is kind of a no-brainer slide. It's really just trying to remind you that we don't have to have something penetrating to actually involve or damage the tissue or the organ underneath it, just like in the chest. So blunt trauma to the abdomen without breaking the skin. Here's just a couple of easy to remember MOIs, which is bicycle handlebars, the steering wheel of your motor vehicle, motorcycle collisions, falls. I mean, really and truly, let's just think about this. Anything that's striking the abdomen that is displaced enough while still carrying force, but has a large enough surface area to not penetrate, can cause blunt trauma. This could be a baseball bat, it could be a hammer, I mean, any manner of things. You guys can think of a million ways to hurt your abdominal area without penetrating. Other MOIs are going to be compression, which is the quick and sudden snap into the abdominal wall from, say, a poorly placed seatbelt, or being run over by a vehicle, or even kind of like a crush injury. Right? So where we'll say a person who was working underneath their car and the jack failed, and the car actually just landed over their abdominal cavity, leaving their chest open. So deceleration movements can actually really create a lot of damage inside, because remember, there's 3 collisions, right? The collision with the unmoving object, the body colliding with something in a vehicle or something else, and then the internal organs colliding with hard fixed objects inside the body. Okay, so signs and symptoms of abdominal injuries. It's the same thing as signs and symptoms of anything else. It's just, where has this started? So if we have some kind of shock-like symptoms, we're going to have tachycardia, tachypnea. There should be some kind of bruising or visible marks that are indicating that we actually got into the abdominal area. You may have crepitus in the lower ribs. Remember, those floating ribs are really, really hard to break. So if you have crepitus in the lower ribs, you know it was a significant MOI, and that is at the level of the diaphragm. So we have a lot of issues going on there. We also have the Kerr sign, and the Kerr sign is when you have somebody laying on their back for a prolonged amount of time, say waiting for to be seen by a physician, and then we see some kind of unexpected kind of blood or discoloration in the shoulder, and that's from blood leaking through the peritoneal space and then making its way up underneath the skin and kind of pooling in a low-lying area. If the patient is guarding their abdomen, that's obviously a very significant sign that they have some kind of inflammation or trauma or injury. So a couple more interesting presentations for retroperitoneal injuries, and the first one's going to be the Gray-Turner sign. And the Gray-Turner sign is kind of a blood pooling or bruising that's kind of unexpected to the right flank or the left flank, obviously. And this just indicates that we're bleeding through the peritoneal space. Then we have Cullen's sign, which indicates a hemorrhage from a high-sitting or upper organ, and it's actually making its way around the navel. And if you guys remember, just at birth, the navel actually had a vessel that ran towards the liver in the fetus, and then now infant or neonate. That vessel actually disrupts and becomes nothing. It just kind of shrinks and disappears inside the baby's body. But that is still a penetration through the abdominal cavity. That's kind of like a, so to speak, a scar from the initial structure from when mother fed baby. All right, so this is a quick blurb about seatbelt positioning, and this is absolutely why putting children in car seats and then booster seats is essential, and that's because for the most part, ambulances included and their restraint systems are developed around adults. Pediatrics really are kind of not high on the list of things that people develop vehicles for. And so if you're looking at the way this seatbelt sits, the correct position is to actually have the seatbelt sit across the pelvis. We're using the pelvis as a way to maintain and protect the location of the belt so that it applies force across the body evenly. And as you can see in the upper parts of these pictures where you have 2 different incorrect placements, the soft tissue becomes the keeper of the belt and allows it and actually exposes that organs or organ systems to actually directly take force in the event of a collision. Okay, so in this slide you can see that there's a picture of a human body that has some tissue kind of exposing or avulsing out of a penetration. I'm not sure exactly what caused this, but the slide in itself is purely based on open abdominal injuries, which means that we have a penetrating injury. And because for the most part things will actually kind of snap back around when something's been removed, we have very little idea of how deep something is, if there's an actual wound, and then we can't really develop or determine an idea of what organ systems may be at play and the path of the entry. So there's a cone of injury, so to speak, that it directly lies on the other side of this penetration. So MOI can give you a little bit, but in reality, A stab wound is going to give you very little information as opposed to like a gunshot wound. You just know that one had significantly more force behind it, but the amount of damage could be the same regardless. All right, so in this picture you can see what we call an actual evisceration, and you can see the bowel contents have kind of spilled out. Now remember, all of the organs inside the body are under a little bit of pressure, right? We have atmospheric pressure pushing down. The abdominal muscles are creating this girdle to support your upper body weight as you walk and things like that. So if we get a significant rupture, the internal organs will actually evacuate out of the cavity. And as you can see, this can be really, really traumatic. If you were to see this on yourself from a small laceration through the abdominal wall, like in a traffic accident, and you saw bowel protruding, you might think you're dying right now. In this type of situation, we really want to use very gentle care there, and that's a moist, sterile dressing, and we're just going to apply that. We're not really trying to look at anything or pick anything up. You might loosely irrigate if there's some debris on it, but that's about it. Cut the clothing away from the wound, get it covered up, and get these people transported. Obviously, your signs and symptoms of open abdominal injuries are going to be bleeding. You should see an entrance and an exit wound. And I want to caution people from thinking that they understand the difference between an entrance and an exit wound. Treat all wounds like they're entrance wounds, unless it's grossly obvious, like in the instance of a gunshot wound. If you see a small pencil-style size wound on one side of the body and the back side of the body is about the size of your fist, then you can reasonably say entrance and exit. But other than that, we can start to get caught up into thinking that we know what the entrance wound was and then the exit, and it may be two actual entrance wounds. So the general rule of thumb is anything that you see as a hole into the abdominal cavity or even into the thoracic cavity, just call it an entrance wound. The tachycardia is the associated symptom because they're probably bleeding internally, and then later signs as they're bleeding more is going to be evidence of shock, which is going to cause a decrease in mentation. And then if they're bleeding into the abdomen, you're going to have a distended abdomen because the blood is taking up volume. Again, like the cranial vault, the abdominal cavity has a finite volume, and as we add blood into it, we're going to push organs up and forward, which is going to create that distension.